Hi everyone, do you all remember your last doctor visit? I'm pretty sure we can all agree that when we visit our doctor, we are thinking about so many things, like finding a parking spot, or going to the right room, or talk about the medical issue which we have with our doctor. But we never think about the uh, costly medical equipment that surround us when we visit our health provider. When we do pay attention to uh, to the medical equipment around us, we may all feel thankful for the medical technology that we have. Believe it or not, medical supplies that are in a perfect condition are thrown away by healthcare facility on a daily basis in United States. According to an article in US News by Anzish Mirza, medical waste can add up to estimate of 765 billion per year. One of those reason is one of the reason so we have a lot of waste is because hospital changes vendors that supplies their medical equipment. Also, some medical material can be thrown out to be replaced by updated model. However, there are more understandable reasons. For instance, some material can be thrown away because they are reaching their expiration date or due to the infection control. To better understand why this is a public health issue, one must first know the range of medical tools that are thrown out from care facilities. Some material can be gloves, surgical masks, glucose monitor, or surgical instrument, or feeding bags. There is a list of expensive equipment that can also be thrown out, like ultrasound machine or infant warmer, so they are which is they are so expensive. The National Academy of Medicine explained that this expensive equipment is a public health issue because our healthcare insurance can depend on the management of this expensive medical technology. Uh, you would think that the healthcare system in United States would have regulation for how to manage medical equipment without wasting costly medical tools. There are policy and procedure that already exist that help the management of medical supplies at healthcare facility. But if those regulations for management worked efficiently, there would there would not be billions of dollars of medical supplies being thrown away in a perfect condition. There are a new regulation that changed the standard for medical equipment maintenance, which has led administrators to spend more money on a new medical material and consequently throw out all medical equipment that is still usable. Many efforts have been made to reduce the amount of medical waste in our healthcare system, but there has not been a real solution to this public issue for many reasons that can be out of control of hospital administrator or physician. The reason why this big problem cannot fix easy is because there is a conflict of interest between the healthcare systems, new policy and regulation, and medical supplies vendors. What this means is that this public health issue is the result of policy and regulation that ensure vendors of medical supplies will always have a money making business. On the other hand, I have proposed a solution that the inevitable surplus of medical equipment waste will be used to its full potential and that the physician misuse of medical equipment will be avoided as much as possible. My solution will be prevention methods that will monitor how much medical waste is caused by physician misuse. For example, a physician dropping an expensive medical tool and using another one. I suggest the amount of tool used by a specific physician should be recorded by administrative staff to ensure a health provider is not misusing medical tools due to the lack of attention. The second part of my solution includes collecting large amount of medical material that are thrown out in a good condition and gathering it for non-profit organizations that help developing countries. After collecting those materials, they will be shipped to underdeveloped nations from non-profit organizations. These medical tools are still in a perfect condition, so that can be used by developing countries that do not have access to these costly medical tools. The least we can do is to make sure that the purpose of medical tools are being used by someone who needs medical equipment. This can be an effective solution because some people have already tried it. Elizabeth McLean, who is registered nurse, collected medical equipment that was discarded to be thrown away for 10 years and shipped this equipment overseas to the developing countries with the help of volunteers. Her organization is called Partner for World Health. This can serve as an example of how this solution can be successful in avoiding medical technology being thrown out. So this is a proof that our health facility that are initiating a positive change for billions of dollars that result in medical waste. If billions of dollars would be spent on costly medical tools, the least we can do is ensure someone is using and taking advantage of those tools. Very much, that's it. Thank you.